On the line from Avive Clinic Mornington Peninsula, I have Dr. Nic Giummarra. Good morning, Dr. Nic.
Morning, Rachel. How are you?
Very well, thank you. Now, Avive Clinic Mornington Peninsula is quite a new facility up in Mount Eliza,
Yep,
specialising in, well, you have in-house stays and specialising helping people with all forms of mental health. Now, Dr. Nic, what is your role there?
Good question, Rachel. I've fortunately got a very eclectic role, which suits my experience and personality probably. Mostly I'm there as I'm a trained GP, so I do a lot of the medical-based things and the physical health things that come up for patients from time to time. But I'm also employed, I've sort of got a background in psychotherapy and neuroscience and interest in all things esoteric, so I can do all sorts of things there from, the physical health side of detox recovery, but also have longer, deep and meaningful chats with people.
Yeah, I saw you had a background in some youth work and assisting people with drug and alcohol addictions, and I like that you described yourself as a GP with a twist. So tell us a little bit about the twist, Nic.
I was a youth worker actually before I did medicine, working around Melbourne and on the Mornington Peninsula in youth mental health and drug and alcohol detox. So in a way, I've sort of come full circle and still essentially have come back to actually in-house sort of drug and alcohol detox rehab. But yes, I do as a GP, you do all the regular GP sort of things, but it's probably actually become quite a small part of my work. I'm really drawn more to the psychology, and what I most enjoy really is having sort of deep and meaningful conversations with people. And sometimes when they're at really kind of low points of their life or at crisis point, and trying to find those sort of blockages they hold cognitively, or encouraging them to do some of the deeper work, which often requires going back into your body. And one of the things I most liked about Avive actually was that they very strong on, with a trauma-informed background, to do more of the embodied work with their gym program and trying to get patients out of their head back into their physical body to try to tap in and find and release old, unresolved emotions.
I like that about Avive Clinic as well. They seem to be very holistic and realising the connection between our mind and body.
Correct.
And how
absolutely.
important it is. And I was just on the Avive website having a look at one of the co-founders here, and something he wrote was something I talked about you yesterday, Matt McDorn. He says, I've always been fascinated by the human experience, our sense of self, as well as our thoughts, feelings and words. And you touched on that as well, about saying we're all here having a human experience. And I think you called it a humanistic approach.
Right, yep. It sounds like something I would say.
You did
At
yesterday.
the heart of it, I did neuroscience first at uni and then medicine and all sorts of different medicine. I've been a holistic doctor and I've worked in medicinal cannabis. And really, I've come to the conclusion that most of us are suffering from very human things. But this is my personal view, but I don't necessarily always accept sort of the more biological model that there's something wrong with your neurotransmitters. I find that's rarely true. Often it's just more regular, day-to-day garden variety human suffering and fear and loss and attachment and relationships and lack of purpose and lack of finding your sense of identity. Really, most of my conversations, even if somebody comes in with an addiction or a substance problem or a previous mental health diagnosis, it normally always comes back to those sort of root causes of what it means to be a human in this sort of modern, crazy, technological society. I rarely find somebody who's not suffering. That's usually the root cause of their underlying problem. At Avive, we do drug and alcohol and substance addiction, detox and rehab. We know that that's part of the problem, but it's not the cause of the problem. And so I think we're trying to build a whole team that really can find ways to help patients, get to the root cause and relieve it and resolve it.
Well, we are all very similar, aren't we? We're all having a human experience. And I was looking up, today is Friedrich Nietzsche's birthday.
Oh, wow. Okay, there you go.
I thought that tied in beautifully with one of his quotes: to live is to suffer, to survive is to find some meaning in the suffering.
Yes.
And I thought that was quite appropriate for today's conversation.
That's almost very Buddhist, that approach, isn't it, as well? Life is suffering, the first noble truth.
Yeah, and to find some purpose in the suffering.
Yeah, I think it's funny. I think a lot of people, and honestly, myself included, hold this sort of idea that we deserve to live a life that's a certain way, or that we should be happy all the time. And actually, aspiring to that doesn't get you there. It's almost by letting go and accepting the day-to-day suffering, while we're using that term, is probably actually a better strategy, and actually helps you sort of get there, sort of paradoxical ways. What I've found, that actually by releasing and letting go, actually helps you feel more the joy of life. It's sort of the great paradox.
Yeah, and I love this one as well, that nothing is good or bad, but thinking about it makes it so. I always fall back on that one
I like that too.
when I have some minor little hiccup. It's like, well, Rachel, how are you thinking about this? Let's maybe change your thinking, and it might change. Not always. It doesn't always help, but I don't mind falling back on that one. All right, Dr. Nic. Well, I do like a doctor with a twist, a GP, and I think there's always many different ways to solve a problem. So have you got a nice little tip you can leave our listeners with, something that's maybe helped you, or something you think is something quite easy people can do?
Oh, I was going to go with something quite esoteric, actually.
Okay.
Easy would be to, move more, get some sunshine, and express love as much as you can. My more esoteric version was quoting the greats, was going to be, the treasure you seek lies in the cave you fear to enter.
Oh, I like that.
And that quote has been given to different people. I've always known it to be Joseph Campbell, but I've heard it reported from different people. But yeah, the cave you fear to enter holds the treasure you seek. And hopefully at Avive we can walk with you and help guide you and enter the cave.
And receive that treasure. I think that's that's going to be hard to beat, Dr. Nic.
Okay, well, they're good.
No, I like that. Excellent. All right. So you can find Dr. Nic at Avive Clinic Mornington Peninsula. You'll find their website. It's quite a nice, easy website too, avivehealth.com.au. So, Dr. Nic, thank you very much for joining us this morning.
You're welcome. Thank you for giving us the time, and hope to see lots of people soon if they need some help.
Absolutely. All right. You have an awesome day.
Okay. Thank you very much.